Subarachnoid hemorrhages are a type of the life-threatening hemorrhages. The statistics basically show that 1/3 of the patients will survive with a good recovery. 1/3 of the patients will survive with some sort of disability, and 1/3 of patients will die. So it's very sparkling type of statistics, and we have to emphasize that this is a very strong and a very susceptible condition in which the patients can die. So we have to be very careful. The causes, again, they can be any sort of trauma, they can be any type of birth defects or bleeding disorders that will result in these type of subarachnoid hemorrhages. So they are basically dealt within this section. And here basically we'll be dealing with the appearances and the mechanism of formation. What is basically the type of appearance they have, how are they formed, it is very important. And then again, the forensic implications. Why are we studying them in the forensic subject? Why are they important? What has its implications? Then again, the ruptured berry aneurysms. Berry aneurysm, as I was already talking about, there are some sort of birth defects that can contribute to these sort of subarachnoid hemorrhages. So trauma, again, is a cause of these subarachnoid hemorrhages. And alcohol consumption, it's basically going to make the person more susceptible to these type of subarachnoid hemorrhages. So it's basically a risk factor that we're going to consider over here. Obviously, the thromboischemic attacks and basically the vessel permeability is more enhanced in the alcohol consumption. So that is the basic cause over here. Now, the subarachnoid hemorrhages, the aneurysms, as it is shown over here, it's the aneurysms, it can be a berry aneurysms, and it can rupture basically any time. They are very silent carriers, basically, even if it is present at birth, it may not be detected in a lot of people, and it goes symptom-free for an indefinite period of time in a lot of persons, and sometimes these aneurysms rupture without any prior symptoms of these aneurysms. So they are undetected, and they can be a cause of the sudden death in a lot of people. Now, damage to the cortex, it is one of the things that we have to consider over here. Basically, the subarachnoid bleeding is subsequent to this damage to the cortex. The first step is the damage to the cortical area, and secondly, we'll find out the subarachnoid bleeding. The causes, again, as I was discussing, it can be any type of trauma, any type of penetrating injuries can be a cause to these subarachnoid hemorrhages. Then there can be a lot of natural diseases. For example, bleeding dyscrasias and bleeding disorders. For example, thrombocytopenic purpura, idiopathic thrombocytopenic purpura, or a lot of these aneurysms, they are the birth defects, blood dyscrasias are present over there, and these natural diseases can be a layout to these type of subarachnoid hemorrhages. Now, trauma can be of any sort. It can be blunt trauma, it can be with a sharp penetrating trauma. So all of these things will contribute towards these subarachnoid hemorrhages. Now, the appearances and the mechanism of formation. It is again very important how these aneurysms appear. It is very important. Now, what happens here is blood in the subarachnoid space mixes with the CSF, which dilutes it. So it is the first step. First of all, the blood in the subarachnoid space will mix out with the CSF. And secondly, what will happen is there is some sort of bleeding high over the cerebral hemispheres, which readily slides down to cover the brain and enter the basal skull fossas. So these are the areas which are more prone due to the gravitational forces which come into play after the hemorrhage. Now, the sulci tend to collect more blood, especially in the insula. So it is very important, and we have to keep this in mind as well. The hemolysis turns the CSF a xanthochromic yellow and within weeks, and the blood is gone after that. Now, a positive Pearl's reaction for hemosiderin develops within 36 hours and may remain for months or even years. So this is how after some sort of time, these are the changes that will occur in the hemorrhages, and we can detect these changes. Basically, why are they helpful? Because we can detect them in the series or MRIs that we can perform in such patients. It forms a trap for those attempting to date both the subdural and subarachnoid hemorrhages in infants. So, in infants, if we suspect any sort of child abuse, we can still detect it, whether it was at some sort of different time intervals, or it was a single trauma that was a cause of this hemorrhage. So, these are basically, if we find on the CT different hemorrhages at different stages, that means there was a repetitive trauma to the infant, or the infant was subjected to continuous child abuse, and that was the cause of the death of the infant. So basically, we are going to date the hemorrhages according to the epansis, and then we are going to find out what was the cause of death. So this is how it is forensically implicating towards the epanses are implicating towards the forensic significances, and how are they medically important. Now, the forensic implications of the brain membrane hemorrhage. It's again very important. Over here, you can see we have these lateral ventricles over here in the diagram. Now, the latent or the lucid interval in both the extradural and the subdural hemorrhages. So basically, the lucid interval, as I've already defined it, as it is the time interval, basically it is symptom free, and is the time interval between the actual impact of the trauma towards the interval when the symptoms appear. So it is basically in between time period, which is usually symptom free after the trauma, and we are regarding it as the lucid interval. The damage is there, but the symptoms are not there. Now, the dating of the subdural hematomas, again, it is forensically important just to detect the kind of abuse if the patient was subjected to it. The possibility of previous bleed. So there can be some sort of possibility to some sort of previous bleed which was on the previous dates. So we can just mark them by their physical appearance on the CTs. Now there can be an overinterpretation of these brain membrane hemorrhages, whether it may be subdural or it can be extradural hemorrhages. The ruptured berry aneurysms and the trauma. Now, as we've already told you, that the berry aneurysm is over there and is usually symptom-free in a lot of patients. So trauma can basically put it into a state in which it can collapse or it can rupture. So trauma can be a cause to its rupture, but the Berry's aneurysm has already been there since birth. So we have to keep that in mind. The major cause of the medico-legal problems is that we have to relate whether it was the trauma that was the cause to its rupture or not. Occurring after the blunt penetrating or the iatrogenic head trauma. The traumatic intracerebral aneurysms are quite rare over here. And spontaneously leaking aneurysms, neurological or behavioral abnormality can be a cause to these ruptures of the Berry's aneurysms. So we have to relate basically these Berry's aneurysms to the trauma, or whether it was a neurological or whether it was a behavioral abnormality. Basically, it is going to classify the cause of death into homicidal, suicidal, and the accidental sort of. Now, the subarachnoid hemorrhage and the alcohol. Again, as I was talking about, alcohol is basically a risk factor that basically causes an increase in the vessel permeability and is basically going to make the person more susceptible to these subarachnoid hemorrhages. The alcohol increases the chances of the rupture, and it facilitates the bursting of the aneurysms. So basically, the aneurysms burst more actively under the influence of the alcohol. And it causes or contributes to the unsteadiness, falls, or the traumas, again, which can cause the subarachnoid hemorrhages. The rapidity of death in the subarachnoid hemorrhages is basically dependent upon the exhibit substantial bleeding into the basal cisterns at autopsy. So basically, the autopsy reports are very important over here. The post-mortem CTs and the MRIs done in this case are basically having their own significance. The brainstem and the cranial nerve roots being bathed in a thick layer of blood and clot. So that is basically going to be the highlight, how rapid the death can be after the subarachnoid hemorrhage. So in this section, basically, we dealt with the subarachnoid hemorrhages that, as was already talking about, it is a very critical situation and it can cause death in almost 1/3 of the patients. So we have to clinically correlate with it, and it has its own forensic significance. That was the end to this section. Thank you for watching sqadia.com.